Okay.
Hello, all. Good afternoon. Thanks for coming. My name is Dr. Gopi Ramadurai, one of the stroke consultants in Southmead Hospital. And thanks for Gemma and Heidi to give me the opportunity to speak. Yeah, I've seen a few recordings from before, and I thought this was an apt one to speak about as well, because the brain's the main thing that's affected in stroke. And what the brain does is remarkable, as we all know. So I always start with this painting, which is widely regarded as one of the top 100 paintings that was ever painted. Can anybody in the audience, I mean, I know we are not live, we are on technology with Zoom. Can anybody shout out what they see in this picture? Or why have I put it? Anyone?
You're testing us now, Gopi.
I'll stop the testing after this, yeah? Because we
Someone,
want,
someone in the chat has said God. They can see God.
yeah, lovely, yeah. Do we see anything else?
I'm sure I learned this in my history lesson at some stage, but you know what? My brain, when I put on the spot, my brain goes
Emma.
to mush.
Pardon?
I said, when I'm put on the spot, my brain goes.
This place was recently in news. Very recently in news.
Is in Rome, hey?
It's
With
in Rome.
the Pope.
Yeah. This is in Sistine Chapel, ceiling, where the Pope gets elected. Okay.
Someone saying that they see an expression of
Yeah, I'm seeing the
creativity.
chat as well. Yeah.
Yeah, and the
But
connections.
there is a reason why I've put this. Yeah, this is one of the masterpieces of Michelangelo, which actually depicts the creation of Adam. And if you can see my pointer there, can you see my pointer?
Yes, I can.
Yeah, Adam is on the left looking at the God, and the God extends his hands, but the hands are not touching. There's a little gap between the hands, yeah, between the fingers, yeah. So Michelangelo produced the Sistine Chapel with all the scenes of creation. So the first one on the creation was separation of light and darkness. The second one was this. The third one was expulsion of Adam and Eve out of the Garden of Eden, and then Moses came and things. So the Sistine Chapel paintings depict the scenes of Bible in a logical way. But there is one particular important thing on this. Yeah, Michelangelo, it says, fooled the Pope saying he put God created man. Yeah, but actually, what Michelangelo means in this meaning is that's a very accurate prediction of the brain. If you can see my thing. Yeah, the red cape around Jesus or around God, not Jesus, God, is the skull, and what you see inside is, as the little people inside, is actually the brain. Yeah, so those
Well,
are
I've seen
what.
that picture many times, but I've never seen that. But now I've seen it, I won't be able to
Yeah,
unsee it.
so actually the red cape is the skull around the brain, and these little cherubs and God himself are parts of the brain. And this leg of the cherub under the god is the brain stem. And this is one of the most important arteries called the basilar artery, which supplies the brain stem, which is the green cloth that's flowing. Can you see the green cloth flowing? That's
Yeah.
the station of the basilar artery, and you see the brain stem before. And this is an as accurate representation of the brain that Michelangelo could have had in Venice, in Rome at that time. Because Michelangelo was also a painter, he was an architect, but he was an anatomist as well. So he was doing human anatomy and he was a polymath. Yeah, okay. So why I put this is, to start with, we all think God made man, but Michelangelo wanted to suggest that the brain makes the man. It's our brain that makes us. Yeah, okay. With that introduction, I'll show you how it relates to brain later. Before Michelangelo, The Greeks were amazing, and Hippocrates knew this. He told, who could have foretold from the structure of the brain that wine could derange its functions? Yeah. He knew the effect of wine on the brain. He knew about the brain. And Greeks have contributed why strokes called stroke. I'll come to that later. Yeah. Okay. So we know that wine deranges the brain. Lots of other chemicals deranges the brain, including drugs, which are illegal, which are even legal drugs like diazepam and other medications which make us sleep. And also stroke, multiple sclerosis. They can all derange the brain functions. Yeah. So Gemma asked me to do this talk. Gemma and Heidi asked me to do this talk, but I should confess that brain is one of the most complex organs, and the brain has got more name, features, and landmarks than any other part of the body. Each part of the brain you see has got a name. Each structure, each collection of neurons have got a name in the brain. And I've taken this sentence from Bill Bryson's Body the Illustrated. It's an amazing book. I don't know how Bill Bryson puts all this information into a small book. This is very related to his previous book, which was a short history of nearly everything. He's put the whole history of humanity in a few hundred pages, in around 600, 700 pages, and it contains so much of information. And when I read this book, The Body, I still learn a lot, which I've not learned in medical school or in my for 30 years as a doctor. So it's an amazing book. I would encourage people to read who have not read this, especially the parts in the brain, how the eye works and things. So if I'm boring you with a lot of words later on, it's not because of me, it's because of the brain structure itself. It's not me, it's the brain. Yeah. Okay. That makes us behave all those. Yeah. Um, so the nervous system is broadly divided into two things. One is the central nervous system, which contains the brain and the most important spinal cord, and the peripheral nervous system, which helps us move our hands, fingers, and our joints. Yeah. So I'm going to speak only about the brain today. I usually do this lecture as an hour, but Gemma has given me 20 minutes, of which 10 minutes have already gone. Yeah. I'll try to do justice as much as possible. I hope you all can hear me. Yeah. Okay. So that's how the brain looks. That's how the brain looks. It looks like a mass of jelly. Yeah. It feels like a mass of jelly. The surgeons have said I can poke my finger into the brain. It's a squishy thing. Yeah. And I put a piece of jelly on the top to say how it actually feels. And if you see the brain from outside, it looks the same everywhere. The front looks the same, the back looks the same, except there is a little bit of more folds here. That little tube here where the rope is tied is the brain stem. Yeah. So, but it's remarkable that each part of the brain, even though they look similar outside, even though they look similar under the microscope, each of them do different functions. And when each of these parts gets damaged, that results in the loss of function which that part of the brain was doing. And this is nowhere more evident than in stroke. And this happens in a few minutes in a patient with a stroke. And we can identify exactly with what the patient has, with what part of the brain that's involved. Yeah. Um, so it weighs around just more than a kilogram or 3 pounds, which is 2% of the body weight. But and 80% of the brain is water. Most of the body is water. 60% of the brain body is water. But then it's a bigger content even in the brain. So 70 to 80% of brain is water, and only the rest of 20% is solid content. It's made of 100 billion neurons. It's made of 100 billion neurons. But even if a few neurons are lost in very particular areas, the patient's life can be completely changed. They can be paralyzed on one side, they can't speak and things. Yeah. When I say brain is senseless, you can cut the brain in a living person. If you open the skull, the brain won't feel the pain. The brain won't feel the pain. It's the part of the brain, the part of the body which that part of the brain supplies will feel the pain. So the brain never feels the pain because the brain does not have a nerve supply. So the surgeon can cut the brain, but there'll be no pain in that part of the brain. Even though it's a very small organ, it's a very greedy organ. It uses 20% of energy that comes from the heart. So 20% of blood supply goes to the brain, 20% of oxygen, glucose, and everything goes into the brain, and it needs a constant supply. When this supply is cut off, especially in stroke, the brain cells start dying within 4 minutes of stroke onset. So even by the time the patient realizes that the patient has had a stroke, part of the brain would have died. So we always ask the patient to come to the hospital as soon as possible so that the remaining part of the brain can be salvaged. And as I said, it feels like a pudding or a jelly, and that's the cause of whole problem in the whole world. Yeah. Okay. Um, so of all the human organs, the brain is the most well protected organ. Yeah. If you take stomach and kidney, there is no bone protection. Yeah. The abdomen is exposed. You can put a knife into the stomach and kill a person by tearing the stomach or the kidney. The heart and the lungs are only partially protected. The rib cage doesn't cover the whole of the chest wall because you need that, because you need the lungs to expand when you breathe. Without With a rigid rib cage, you can't breathe. So the God has created, or nature has created, a partial protection to the lungs and the heart. But when it comes to the brain, there is no leverage to any fault. So the God's nature has put brain in a big skull, which the Egyptians knew can be reached only through the nose. So they siphoned out the brain of the pharaohs before embalming them by going through the nose and taking out the jelly-like brain from the nose, through the nose. And what the neurosurgeons, clever neurosurgeons, do nowadays is, if the patient's pituitary gland, which sits here behind the eye, is enlarged, they can do a surgery through the nose and take the pituitary gland out. And the Egyptians knew it 5,000 years back, that you can reach the brain through the nose. So the skull's a very good protection for the brain, but in maximal injury, the skull can still get affected. Yeah, and that's why whether the other parts of the body is protected in a motorcycle driver or something, helmet is compulsory. A helmet is compulsory, so the head is protected. And when you go beyond the skull, you have the meninges, which protects the brain from the effects of the harmful chemicals and things. And again, the Greeks and Latin were amazingly creative in naming the in meninges, because they named it as dura mater, arachnoid mater, and pia mater, if you see on the right side. And mater means mother in Latin. And they thought this meninges protects the brain like a mother protecting its child. It protects the brain from undue exposure to chemicals, from undue exposure to pressure and jerks and things. So when I look at the names, I'm interested in etymology in medicine as well. I look at the name origins. It's amazing how the brain parts have been named and body parts have been named. Yeah, and that actually they thought the meninges protects the brain like a mother protecting its child inside the skull. And now you can correlate with what I was saying from the Michelangelo's painting and the brain. Can you see the similarity all? Yeah, that's the lateral part
Yeah.
of the brain. You can see the brain from Michelangelo's painting there. Yeah, so that's the brain stem. That leg is the brain stem. That green cape, a green flowing cloth, is the basilar artery, which gets blocked, causing devastating stroke and brainstem stroke in young patients and old patients. Yeah, and you can see that's the surface of the brain, and that's all the curves which Michelangelo has put there. Yeah, so you can understand how Michelangelo has merged brain as a god. Yeah, and the most important parts of the brain, the colored parts on the top, the pink, the lilac, and the yellow parts are called the cerebrum, which is the biggest part of the brain. The little convoluted thing behind is the hindbrain or the cerebellum. I'll come to the functions of these. And the pons and the medulla oblongata with the midbrain, which is hidden inside, is the brain stem, which keeps us alive, by connecting it to the spinal cord. Um, each part of the brain is important. Some parts make us what we are, some parts give us the memory, some part is important for vision, some part is important for movement. We'll come to that later. Sorry, yeah, someone wanted to ask question? No? Okay. If you have any questions, you can put it on the chat now. Yeah, okay. So as I said, cerebrum is the largest part of the brain. Um, all the motor function, sensory perception, and everything resides in the cerebrum. Yeah, I'll show you what cerebrum looks like inside. Cerebrum is also needed for intelligence, memory, and learning, especially the left side of the brain in most of the people. Um, the lobes of the brain, the frontal lobe, the blue one is the biggest lobe. The yellow one is called the parietal lobe. The green one is the temporal lobe. So there are four lobes in the brain, and people who might have studied psychology might have come across Phineas Gage. He was a railroad worker in US in the 18th century. This was a time when dynamite was discovered. Yeah. So they were using dynamite to break the rocks to put railroad in US, and one of the rods poked his brain and came out, poked his eye and came out of his skull like that. Can you see on the left side? Yeah. And remarkably, Phineas Gage survived this. Remarkably, Phineas Gage surgeon was able to take out the rod, and he lived for a few years after this injury without any infection or anything. But then, because it took a part of his brain, which was the frontal lobe, his personality was completely changed after this. So he was one of the first persons who told the neuroscience people that the frontal lobe is important for personality. Yeah, he's a person in history of neuroscience you can never forget. And when I come to the next slide, these are the functions of the lobes of the brain. Sorry, as I said, Bill Bryson said, it's a lot of words in brain. So I can't not tell the words in brain and the functions. And if you see the frontal lobe function, frontal lobe is the biggest lobe and it's important for personality. So when the frontal lobe is damaged, the patient can become emotionally bad. They become antisocial, lack of initiative, disinhibition. So we've seen patients walking naked in the ward here who got frontal lobe damages. Yeah, patients with either stroke or other causes that causes frontal lobe damage. They can have incontinence. They can have loss of smell because the smell resides under the frontal lobe. Yeah. Okay. Parietal lobe is the next largest lobe, which is the number two here. It's important for making us intelligent. It's important for calculating. It's important for knowing the right side from the left side. It's important for appreciating texture. So even by closing the eyes, you can know what you're holding in the hand and things. Yeah. So when parietal lobe goes, the patient cannot distinguish right side from left side, or they cannot respond to stimuli that are coming from both the sides. Yeah. So when patients cannot calculate because of the lesions in the parietal lobe, yeah. Occipital lobe is important for vision. The patient can get partially blind if the occipital lobe is damaged, and the temporal lobe is very important for hearing, memory, smell, and listening to what a person speaks. So you can think of when the temporal lobe gets damaged, especially on the left side, the patient cannot speak or understand. They can lose their memory. Yeah, and temporal lobe is very important place which gets affected in people with encephalitis, and people can lose their memory if they have encephalitis even if treated. So those are the four lobes of the brain and the important job they does, and the problems that this loss of function can cause. Cerebellum, as I said, lies behind the cerebrum. Um, it's a very small part, but interestingly, it contains more than 50% of the neurons because it's important for coordination, maintaining balance and equilibrium. Alcohol affects the cerebellum predominantly. So when you're drunk, you're ataxic or you cannot walk properly because cerebellum is affected. Yeah. It also plays a part in memory. Patients with cerebellar strokes, I've seen people losing memory because of that. It just weighs less than 10%, but it amazingly holds 50% of the neurons. Yeah. And then we come to the brain stem, which is hidden, partly hidden inside the cerebrum, and contains three parts, which is called the midbrain, pons, and the medulla. And all of you might have heard the term brain stem death. So even when a person's heart is beating, we doctors, if two of us agree, we can certify that the patient is brain stem dead when they can go for organ donation and things. So you can think of how brain stem is important to keep us awake, aware, yeah, and help the heart and lungs to function. It also has got all the cranial nerve nuclei, which helps us speak, move the eyes, um, help us with the smell and hearing as well. Yeah. So brain stem is a very important part. I'm just rushing through the parts of the brain and the important things. And this is how the brain looks in a three-dimensional structure. Yeah. So inside the brain, you have got a structure called basal ganglia, which is a combination of neurons, which helps us in moving our parts very smoothly. And when this part gets affected, people get Parkinson's disease. When basal ganglia is affected, it can result in Parkinson's disease. Yeah. So there is another structure called thalamus, which is a very tiny structure of neurons within the brain. And I don't know why nature has created thalamus, but it serves as the pathway for all the sensory modalities except the smell. Um, People have lost their memory or the ability to keep awake when they've had strokes in the thalamus. Yeah. So these are parts of the brain which integrate with each other. I can show you a picture how it integrates later if you can understand the picture. I can't understand the picture, but I'll put it later. Yeah. And this is another beautiful exploded view of the brain where if you stretch the brain out, you can see the internal parts there. You can see the skull stretched out, the skin outside, the blood vessels between the skin and the skull, the cerebrum, the half of the cerebrum, the cerebellum, the brain stem hidden inside. The green parts are the thalamus. And these are the other green parts here, which I'm pointing out, is the amygdala and the hippocampus, which are involved in emotions and memory. A patient with whose amygdala is affected can become emotionally labile, an angry person, and can lose their personality again. Yeah, okay. And that's the mirror image of the other side. So we've got two parts of the brain. And this might you might have heard of inverted human in the brain, yeah, which controls the movements and things. You can see how mouth and tongue are important, which causes problem all over the world, and they are represented in a very big way. Yeah, okay. It was Trump's tongue that let out the F word yesterday. Yeah, okay. And tongue can cause maximum problems in the world. Yeah. And because tongue is important for us, it's represented in a big way in the brain. And corticospinal tract is the way how we move our arms and legs. And it starts from the brain, goes through the spinal cord, and gives nerves to the brain. And as a stroke physician, this is one of the most important tracts which gets affected in stroke. Yeah. And depending on which level it gets affected, the patient can have different symptoms of the stroke. And the most important supply for the blood comes from the neck arteries, the two neck arteries in front and two in the back, which are called the carotid arteries and the vertebral artery, which form a circle in the brain called the circle of Willis. Um, the nature has provided a bit of anastomosis between the carotid artery in the front, which is big, and the vertebral artery. But like most things in nature, this is not a perfect thing. When the stroke gets affects the brain, it can sustain the other parts for a few minutes, but until a remedy is done, the circle loses its supply. So we need the patient to come in as soon as possible. Yeah. And we are electric. I mean, there's a book called Body Electric and We Are Electric. And this is a dialogue from the famous film Matrix. Yeah. And where Morpheus says, whatever we feel as real is just electrical signals interpreted by the brain. What I'm seeing on the screen now is electrical signals interpreted by eyes and the brain. What you're hearing is electrical signals that are interpreted as sound in your brain. Yeah. And that's the basic of physiology of the brain, because what the brain is made of is neurons. And as I said, there are 100 billion neurons. Yeah. And each neuron, if you see on the right side, connects with other neurons through thousands of synapses, through thousands of synapses. And when stroke happens, or multiple sclerosis happens, or encephalitis happens, these synapses are destroyed, the neurons are destroyed. And no other neurological disease destroys these neurons as fast as a stroke does. That's why the effect of stroke is maximal when the stroke happens. And if you remember Dr. Clatworthy's talk few months ago or a few years ago, the brain takes time to repair itself. That's plasticity. Yeah. But the damage is done and it never comes back to its normal self. And you can see on the right side animation, the GIF animation of neurons, the synapses forming and synapses being destroyed as well. Yeah. And there are lots of chemical things that go in. Yeah. And then how, as I said, in the corticospinal tract, how it is integrated is through the motor pathway, yeah, on the right side, and through the ascending sensory pathway, which goes from the fingers, from the legs, and from the body into the brain to help us recognize the sensations. Yeah. Jim, I'm going a little bit over time. Yeah. I'm conscious of that and
No
see.
problem. No problem.
Yeah.
Take your time. Take your
But
time.
few more slides. Yeah.
Yeah,
Okay.
no, it's fine.
And as I said, complex brain. I can't understand this picture, how the brain connects with each parts of the brain inside. Yeah. I'll give you a link for this website. It's a very beautiful website. This is an AI generated image of, I can't go through everything on this slide. I can take 2 days to go through the slide. But I'll give you the website and you can go and see how complex the brain is, how the connections are made in the brain and how each part connects. Yeah. Okay. And you can see the most important modalities are sight, smell, if you can see my arrow there, taste, touch. Then you've got the where is five? Hearing, balance and acceleration, joint position, and facial expression. And each of these sensory modalities interact with each other. So when you eat or drink, you not only taste the food, you also smell the food. You also feel the food texture in your mouth. Yeah. When you're listening to this lecture, not only your eyes are seeing, but you're hearing it as well. And probably some people might be eating during the same time during the lecture. So you're doing three or four things and the brain coordinates everything. And these are the lines of thing. And this is even another complex picture. Yeah. I need to expand it to see what the structures are. But I've given the name of the website on the top. It's called The Highest of the Mountains. That contains some amazing information about the brain, how the ear helps in the balance, how the modern, what do you call, the flight radar and flight projectors on in the aeroplanes have been modeled after the human ear. Yeah. It's all derived from nature. Yeah. We started flying after seeing birds flying. Everything is from nature. But if you go to the website Highest of the Mountains, it's a beautiful website that gives you more details about the brain as well. And now we come to the important topic: how is the brain anatomy related to the stroke? Yeah, and we as stroke physicians always say time is brain. The earlier the patient comes in, the better for the patient. Yeah. Okay. So why the name stroke? Does anybody know? Gemma, do you know?
I've no idea, I've
Oh,
never thought
yeah.
about it.
Pardon?
I'd never thought about it,
Does
but
anyone know on the audience? It's always a question I ask in my teachings. On the left side, you see a patient who's had a stroke lying on the bed, helpless. The doctor is looking at his wife to see what he can prescribe. He's got lots of medicines on there. Yeah. So that's how stroke makes a person helpless. Yeah. Immediately after it happens. And again, we need to thank the Greeks for this. Yeah. As I said, Hippocrates knew what wine does to the brain, and he knew what stroke does to the brain as well around 2400 years ago. They called it apoplexia, which meaning you're struck down by violence. Yeah. So you're standing up 1 minute, you have a stroke, you're on the floor. Yeah. And Greeks thought the god struck the patient down. So we've taken the word struck down as stroke. Yeah. A stroke is a stroke of bad luck where the patient just comes to the ground because the arm or leg can't work or they cannot speak. The Greeks thought it was a hand of God that struck the patient down. Yeah, okay. And from then on, we've used the name stroke forever. Yeah. Some people now use it as a brain attack so that we can understand with a heart attack. Some people call it cerebrovascular accident or cerebrovascular incident. Yeah. But stroke's still a popular term. Yeah. And that's where we think the stroke word came from the Greeks. Yeah. Struck down by violence by hand of God. Yeah. Um,
Wow, thank you. And now I know.
yeah, lots of people have never heard it. I mean, it's quite surprising. Even many of my colleagues, I had to teach them. Yeah. Um, and so these are the CT scans of two stroke patients who had stroke on the right side of their brain because the CT scan reverts the side. What you see on the left is the right side, and what you see on the right is the left. On the left is the most common cause of stroke, which is a clot stroke, where most of the research is being done. And Southmead is one of the leading centers where we go into the brain and take the clot out in patients who are still eligible. Yeah. And the left side is an unfortunate bleed stroke. On the right side is a unfortunate bleed stroke patient, with the white blob is the bleed, which is caused by a rupture of the artery, which is caused by a rupture of the artery. Both of them cause very similar effects on the patient. Yeah. So it causes loss of function on the opposite side. It causes loss of speech, loss of difficulty in eating, lot of difficulty in walking, and loss of their independence as well. Yeah. So why we call time as brain? In each minute when a stroke happens, 2 million neurons die. 2 million neurons die, but we have 100 billion neurons, I said, which is a lot of neurons. But if the neurons are in specific sites which affect us, it can, even a small amount of damage can cause long lasting effects. Yeah. 14 billion synapses, these are the connections between the neurons, and 14 billion synapses die, and lots of miles and miles of nerve fibers are destroyed in stroke. Yeah. um, in each minute. Yeah. And this is scary. Stroke's the second largest cause of dementia in the world. Stroke and cerebrovascular disease after Alzheimer's disease. And when a person is having a stroke, their brain can age 4 years every hour without treatment. Yeah, with every hour. So by the end of the stroke, I should have put every hour. I don't know why every hour might be hidden inside. So every hour you become 4 years older if the stroke's not treated in your brain, not physically, but mentally you become 4 years older. Yeah. And those are different parts of the brain that are affected. The front part of the brain, the back part of the brain, which affects mainly the vision. And CT scan has revolutionized what we see on the brain. Yeah. 20, 30 years ago, there was no CT scan. There was no MRI. There was no radiology. There was no radiography. But now we can see what symptoms the patients will have. Yeah. And we can also speak to the therapists. Can you hear me, Gemma? It says cannot detect your microphone.
Yeah, my signal was a bit unstable then, but
Uh,
you cut out for a minute, but you've come back again.
Back
I
again.
don't know whether it's me or you. Sorry about that.
Yeah, I'm also speaking through my phone. So we can predict. So what I always do in my ward rounds is see the patient, see the scan, or see the scan and see the patient, and I would know what damage the patient would have. And then I can speak to my therapy team to see where we need to focus on to make the patient better. Yeah. Now, these are the books which I've always been impressed with brain reading. Once the book, which is a medical book, which may not be of much interest to you guys, because this has stayed with me since 1990s when I was in medical school. Yeah, it's come through many editions. Snell's Clinical Neuroanatomy. It's an American book. As I said, Bill Bryson has put a lot of information in one few pages of the brain. Yeah. And then the two other books which are amazing is one by David Eagleman, The Brain, The Story of You, and We Are Our Brains by Dick Swab. from womb to Alzheimer's. If any of you are interested in reading further books on the brain, there are more books which I've read or referred for this talk. But I quite like these four books which give me more information about the brain. And I always wonder this: who created the brain? Is it the God or what nature created? Yeah, that's the end of my talk. It I had to rush through it a little bit. Yeah. But I hope I've covered the most important parts of the brain and the brain function. Yeah. But if given a longer time, I can make it even a bit slower, Gemma.
Thanks, Alfie. I'll just pause the recording.